I just noticed she didn't want anybody anywhere near her mouth. Beautiful cat, wanted to purr, rub her head on you, couldn't get anywhere near her mouth.
Carolyn, are you coming back out?
Yeah.
Okay.
I
Yeah,
just get upset.
No, we just need. We
Just want to get to the
yeah,
back
we
of the
don't,
shop.
we don't
Yeah.
need you. Yeah, we don't want you to move around too much in the
Oh,
shop.
I'm sorry.
It's okay.
You obviously were familiar with her health. Was she? You had charts on her. She had been to Adobe before.
Yeah,
Was she otherwise a healthy cat?
she was otherwise a healthy cat according to our medical records and our exam by our veterinarian.
So a 15-year-old cat, otherwise a healthy cat, and she essentially had not an illness but an injury.
Yes.
And the injury was what?
The injury appeared to be trauma sustained to the underside of her tongue to the point where it was almost completely severed from the bottom of her mouth.
And what will that do to an animal? I mean, because for most people who think about an animal on their tongue, they think about them maybe lapping a little water. They think about them giving them kisses and licking them and things like that.
Yeah.
But what practically are we talking about in terms of how devastating an injury that could actually be for them?
Well, we also have to entertain the species as well. This is a cat, and cats don't have lips like you or I do, or like say a horse does, where they can prehend their food using their lips, or where they can drink using their lips. They depend completely on their tongue to be able to get water and food into their mouth.
And so without that, she's essentially starving if
Starving
she can't
and
utilize her
dehydrated
tongue.
to death.
And I would imagine that she has no mobility, or she has no ability to manipulate her tongue if it's lacerated and there's a deep laceration between sort of the muscle that would control it and the tongue itself.
That's correct. She had no means of moving her tongue.
Was the injury consistent with what could happen during a teeth cleaning?
The injury was consistent with what could happen during somebody trying to clean teeth with sharp objects and not being very good at doing that. Yes.
So let me ask you this. Under normal circumstances for teeth cleaning, are animals put under anesthesia? Are they sort of knocked out so that the doctor can operate around in there and do things kind of like if I were going to get a root canal or if I were going to get something major done in my mouth, they would go ahead and knock me out, make my mouth open so that they can move around and I won't be moving?
It's partly, yes, so that they won't be moving, but it's obvious, and I don't want to sound silly, but as we understand animals, we can't explain to them what it is that we're doing. They don't open their mouth for us and say, and let us explore around in there and find out what's going on.
So anesthesia,
Anesthesia renders them safe. Their airway is protected. They're not going to suddenly inhale when we have an ultrasonic scaler that has water along with it squirting on the teeth. Their airway is protected. They're not going to inhale that water and that bacteria. They're under anesthesia, so they're safely asleep, so they're not in a panic. They don't have to be rolled up like a mummy in a towel and pinned to the floor.
there are a lot of people who, let's face it, we're in California, and there are a lot of people who are sort of anti-medicine, anti-anesthesia, anti-vaccinations, anti. But you're saying that in the case of an animal, again, if you're going to be able to control that animal during a procedure where you're trying to deal with their mouth and the animal's head is going to be moving. I mean, everybody knows who has an animal what it's like to even try to give them a pill or give them something when they don't want it. They're going to move around. They're not going to just sit there and just take it. So you're saying that the anesthesia is what actually provides a safe environment for that animal. Otherwise, you're dealing with a moving topic, a moving target, so to speak, with a sharp object in a very limited amount of space.
You're dealing with a very stressed, very terrified creature that doesn't understand why you're forcing sharp objects into its mouth.
And that's what happens when somebody is trying to clean a cat or an animal's teeth when they're not using any anesthesia.
They don't understand what you're doing. And when you're in the dentist chair, when I'm in the dentist chair, we don't necessarily walk out of that dentist's office saying that was a delightful, pleasant, and comfortable experience. But we understand why we're there, and we understand what they're doing for us. Sometimes it's uncomfortable. Sometimes it's even painful. But
they
we
generally
understand
give
what's
us at least a
happening.
local,
They do.
so that we're not squirming
Right.
from the amount of pain that we get. I mean, again, if you're going to equate it to human health care, you're going to get a shot of Novocaine, or 2 shots, or 3 shots, or gas, or whatever it takes,
Exactly.
so that you're stable, so that when they're drilling or doing whatever they're doing in your mouth, you're not moving around too much, and so that it's safe, because you're talking about limited space.
Talking about limited space, and you're talking about the things that are in a state of panic moving around when there are very sharp objects in their mouth. And those sharp objects are the only thing that remove the tartar from the teeth. How do you communicate to a terrified animal, you need to sit perfectly still as I make you very uncomfortable?
There's no way to do that.
No.
So in your opinion, should these kind of practices even be occurring at all?
No.
Under no circumstance.
No.
There's no health benefit whatsoever to not using anesthesia on an animal when you're doing something invasive with sharp objects.
Correct, because the teeth, remember, the teeth aren't clean. The teeth on the surface have tartar removed, but that's not the definition of clean. My tooth doesn't end, and my teeth don't end with these 2 white things that you can see in the front. Your teeth are all the way around. They're on the inside, the lingual surface, the side that faces your tongue, that has tartar, that has disease. Underneath the gum line is where the tartar progresses, but they can't successfully remove that on an awake and moving patient. So they return this pet back to the owner, telling them that their teeth are clean. That's a lie. That's defrauding the pet owner. That's lying to them.
Can't be done. They're not going to be still enough to be clean.
They're not going to be still enough, and you will not have access to the inside of the mouth and the insides of the teeth in order to clean the insides. You don't have access to up underneath the gums when you're awake.
Lastly, how long have you been a veterinary technician?
11 years.
11
I've been
years.
practicing. I've been licensed for 6 years.
And you've had your teeth cleaned at the dentist, I imagine.
Yes.
It's not unlike the same process. I mean, our dentist will utilize a hook, and there's an amount of force, and there's some scraping that's involved, and there's an amount of force that is involved.
It's the exact same process with the exact same instruments. These instruments are not made separately for humans and animals. These instruments are identical. So it's the same instruments, and it's the same ultrasonic scalers. That's how you get tartar off teeth.
And so, for a human, I mean, for people who are thinking about it, again, a human, as you mentioned, a teeth cleaning isn't that extensive a deal. But we know how to sit still, and we know how to verbalize if we're uncomfortable or if something hurts us, to get it to stop.
Correct.
The animal doesn't have the benefit of that.
They don't have the benefit of that, not to mention that you have, water and spray that are in the mouth at that time. And when somebody has spray or is squirting water into your mouth, the last thing you do is inhale, right? Well, guess what a terrified animal is doing when you have sharp objects and water and spray and a very loud foreign noise in their mouth and their teeth vibrating? They're gonna inhale, and they're going to inhale that water and that bacteria that's flying around their face.
And they're going to move.
And they're going to move. And they're going to move.
And all of that is a recipe for disaster if you have a sharp object in your mouth.
It was certainly a recipe for disaster for